Hi, everybody. Welcome to the first session of our conference after a most inspiring keynote speech opening from Sue Tranker, our Chief Nursing Officer. I know there's more people that have joined us now, but please do go to the recording of Sue's speech when you can, when we upload it. It was absolutely inspirational. So I'm delighted now to introduce our three speakers who will be launching the e-learning module on global citizenship, which I personally think is going to be fantastic. So I'd like to welcome Dr. Jill Richardson, who is currently our Deputy Chief Medical Officer with the lead for the COVID vaccination programme. So we've got a lot to thank her for. She's worked in the NHS for over 30 years as a community child health doctor, GP, lecturer in primary care, consultant in public health. So she's had an illustrious career and has spent some time working earlier in her career in several African countries. So she's a great supporter of the Wales Africa health movement. And then I'm also very pleased to welcome Liz Green, who has just recently taken over the lead for the International Health Coordinating Centre within Public Health Wales that leads on the NHS Charter for International Health Partnerships. And Liz has come into that immediately with enthusiasm and lots of ideas. So we're delighted to welcome Liz to that role. She has expertise in health impact assessment, and that's what she leads for Public Health Wales, international expert on the subject. So she's done some really good work, and some recent reports that she's been involved in is rising to the challenge of Brexit, climate change, and COVID-19, which is a series of reports I would advise everybody to go and have a look at. And lastly, but not least, is Susie Ventresfield, who is the Chief Executive of the Welsh Centre for International Affairs, so one of the partners in Hub Cymru Africa. She's got a passion for involving people in internationalism, and has been working as a volunteer in that field since 2013. So she's done a lot of work on gender equality, education and inclusion, both here in Wales and overseas. So three women with a lot of enthusiasm, a lot of skills, and I'm really looking forward to hearing what you've got to say. So fire away. Oh, sorry, I should say, Kath, do you want to quickly, I know there's more people join, just quickly remind people about the housekeeping rules for our conference, if you don't mind. Thank you.
Hi, thank you very much. So I know that most of you have heard this, so very quickly for those of you who've joined recently, at the end of the session, we'll be doing a poll, so please do take part in that because it will help us inform how we move forward. The event is in a webinar format, so only panelists can share their microphones and videos. That means that everybody else will be muted. So please use the chat function and the question and answer section if you have any questions to ask, and then we'll feed them into the speakers at the end. Thank you.
Thanks very much. Well, it's so wonderful to be here and to be at the Wales for Africa conference, launching this global citizenship module suite. As Sue says, we live in a global village, and what happens in one part of the world, this tiny globe spinning through space that we all see ourselves on, what happens in one part affects the other. What happens in the US today affects Bangladesh tomorrow, and what China decides tomorrow will affect the results of our Antarctic survey in a year's time. It's not just climate change, although that is a huge issue and that is accelerating, as we know, but pandemics, plastic oceans and acid rains, human rights and their violations, and the refugee crises that occur as a result. The NHS is full of individuals that need to understand these issues, how we can create a globally aware society, how we can understand multicultural issues, how we can dispose of waste responsibly, use energy wisely, and learn about global issues and cultural issues such as respect. So this global citizenship module suite is something that began actually 10 years ago. Public Health Wales and the International Health Coordination Centre began a journey with the Wales Centre for International Affairs at that time. And there've been face-to-face teaching and all sorts of fantastic things that have happened. Hub Cymru Africa has been involved. And the early folk at that time, just want to give a shout out actually, because some of them are on the call. Lauren Cousins, Rebecca Fogarty, Mariana Dikova. And then lately we had a wonderful opportunity to work together with Oxfam Cymru, and Jen Jones led the writing, and Susie from WCIA, who's going to speak later, gathered a whole bunch of partners around to help us in this. So there's been very, very wide input from all kinds of people, third sector professionals and so on, to get us to this point. And to actually be launching it in the week where the UK hosts the COP26 summit is really something else. So why global citizenship? To develop individuals' knowledge, understanding and skills, but also to develop globally aware health professionals and a globally responsible NHS and nation as we follow the Future Generations Act. And then lastly, to empower health professionals to be part of creating the solution to these problems and making a difference locally, but also globally. So thank you. I'm just going to hand over now to Susie.
Hi everybody. So I'm going to say a few words about how the modules work and a few words of introduction. But while I say a few words of introduction, I'm unable to resist doing some interactivity in any session that I do. So while I'm just doing some introductory comments, I've put up the next slide. Some of you may have used Mentimeter before, but if you go either on your phone or your laptop to or any device you've got handy to www.menti.com and put in that code, you'll see this slide and an opportunity to put in 3 global issues that you're most concerned about. And I'm just really interested to ask this question before I introduce the topics of the modules, and hopefully can highlight some overlaps. So just while I make a few introductory comments, if you wouldn't mind following those instructions or trying to follow those instructions, and put in the top 3 global issues you're most concerned about, that would be fantastic. If for whatever reason you struggle with Mentimeter, feel free to just pop those issues into the chat function as well. It doesn't give me quite such a pretty word cloud, but I still get the gist of what you're thinking. So yeah, thank you for the introduction. As I said, I'm Susie Venturesfield. I'm the Chief Executive for the Welsh Centre for International Affairs. And for those who don't know much about the WCIA, we inspire people across Wales to get involved in international and global issues so that they can make a difference to create a more fairer and more peaceful world. And so the opportunity to get involved in these global citizenship modules was incredibly important. We do a huge amount of global citizenship activity in Wales. We reach about 20,000 plus people a year, directly or indirectly. But an awful lot of those are through schools and with young people. And that's so important. But I think sometimes we neglect the opportunity to develop as global citizens in lifelong learning. I consider myself a global citizen, but I don't consider myself at the end of my global citizenship journey. We're constantly needing to learn and change and adapt and think critically about our own perspectives. And as over the last year, we've seen the anti-racism movement and the need to take on board new perspectives and really think deeply about our own role in that is really important. So I think as Catherine said, she's also a global citizen, but she got a lot from these modules because they encourage you to keep thinking critically and keep learning about global issues. It's also something that the Future Generations Commissioner in her 2020 report highlighted as being essential to create a globally responsible nation and to achieve the other wellbeing goals. We need people to have global citizenship skills, understanding, knowledge, and also values in order to be able to create a globally responsible nation. And so we really hope that these modules go some way towards doing that. And thank you. I see lots of you have started to use the Mentimeter. Not surprisingly, in the week of COP26, to see climate change topping the list there. But also we've got COVID-19, absolutely the top, food security, refugee crisis, women's health, wash facilities, water supplies, all of these global issues that cross borders, that are relevant both here in Wales and around the world. But they're also things that we can take action on here in Wales, in our local communities, in our workplaces and around the world. So I'm gonna just finish off that slide now. Thank you for adding your thoughts. I will make the word cloud available later. It's really nice to see such a range of issues there. And I'm going to talk a little bit about the modules themselves and the practicalities. So the modules themselves, and just before I introduce them, I just want to also extend my thanks to those who worked on these. So Jen at Oxfam really led the team working on this, but also Janie Pridham, Amber Demetrius and Jane Harries all contributed content to the modules. So it's been a really cross-disciplinary team, which has been fantastic to work with. So what have we got with the modules? We've got one core module, which you can see there is the Global Citizen core module. And what we're hoping is that those who are interested and take these modules, that everyone takes that core module. It gives a really good introduction to what global citizenship is. It gives a really good introduction to some of the key issues around global citizenship, and also how it connects and how it's relevant in Wales. There are also then 5 deep dive modules which get more into depth into some of the issues around global citizenship. And the idea is that people can take the introductory module and then 1 or 2 or 3 or even all 5 of these deep dive modules, depending on their areas of interest. The modules were developed with NHS staff in mind, so they've been tailored to the health sector throughout. So there's case studies and references to the health sector throughout all of the modules, including case studies and examples from here in Wales and around the world. They are self-study modules. If you're familiar with the Learning at Wales platform, they're on that platform. But we have made an effort to make them as interactive as possible. So it's not just passive reading. There's a lot of interactivity built in to really encourage learning. And actually, one of the things with global citizenship, it's often not enough to just passively take on board information. You have to engage with activities in the modules are designed to encourage that. The modules were developed over, as Jill says, over quite a long period of time, with a lot of input from staff in the health sector. There were pilots, there was a steering group who fed in. The modules went through lots of iterations. So we also did some additional updates following COVID, because obviously circumstances changed quite dramatically. One of the things with modules like this is we felt like we could keep improving them and then never launch them. So, we're sure there are still areas we can keep looking at, but we're really pleased with the result that we've come to and think that they're really engaging modules that people will enjoy and learn a lot from. And then in terms of access, they're accessed via the Learning at Wales platform or via the electronic staff record. So a couple of ways to access those. Now, I am going to try something hopefully not too advanced. I'm going to change the screen that I'm sharing to the modules themselves. I'm not going to go through them in lots of detail, but I'm just hoping that has worked brilliant to give you a sense of what they look like, the types of activities and some of the things there. So I'm hoping that one of my fellow speakers can give me a thumbs up that the modules are now displaying across the screen. Fab, thank you, Jill. So I'm just going to open up the core module first of all. So you can see they're arranged there. Click here to start. So quite a simple way to go. I'm going to go in the normal mode, click on enter. It will take longer because I'm on a video conference, so just bear with me for it loading. And there we are. We're in the first initial module. It starts off by giving a few of the objectives of the course. And then I simply click on start. And excuse me for looking over here. My other screen is on my standing desk, so it's quite high up. And so you can see each course has the aims and the objectives at the top. And then for each of the modules, we've included a pre-course survey, and then we do a survey again at the end. And that's really so that we can understand whether or not the modules are having an impact on people's global citizenship, understanding, skills and values, because we're really keen that these modules do make a difference. And so that monitoring built in is really important. But the questions in those surveys are also designed to stimulate your thinking. So they're not just for us to gather data, but to get you thinking about what it means to be a global citizen and about the issues that are going to be covered in the modules. So it's quite a nice format. For those who haven't used the platform before, it's quite user-friendly. You start by reading the part on the screen, and then you just click the down button, and it takes you to the next section. So it's really quite nice. And you can see here as I click through, it's got several pictures. I just flip them over, looking at the screen there. It's got an activity that explains what you've got to do. And then you've got these really simple matching activities to get you thinking about it. Now I'm going to do these all wrong on purpose, just to give you a sense of how it works. Bit of a matching activity, and then submit. And then you can see I get my results and I can try again. So it really encourages you to engage with the information. And there's lots of different kinds of activity in the course. So you can, you've got the sort of slideshows here taking you through how Wales connects with the world in this example. But you've also got lots of case studies as you go through, and quotes and information from various reports and activities. One of the things you get to do in the initial module, I'm just scrolling through a little bit quickly. One of the things you get to do in the initial module is to explore the global issues that are covered in the deep dives. So I'm just going to skip ahead a little bit. So in each of the deep dives, there's an NHS character who takes you through the deep dives and their thinking and learning as they go through. And what you do in the introductory module is just start to explore those deep dive topics, so you can choose which ones you're going to be most interested in. I won't go through much more of the modules because I want to leave time for questions. But one of the things I will say is that the modules are based on a kind of learn, think, act model, which we use, Oxfam use throughout their global citizenship work, where we initially provide some information. There's then an opportunity to process that information, to think critically about it. And at the end of each module, you'll find this section around how can I be an active global citizen. So each module gives you ideas and suggestions and thinking time about what you can do, both in terms of your own behaviours, but also what you can do in the workplace, what you might do in your local community, but also what you might do in interaction with partners around the world. So it gives you some really practical ideas about how to take action, not only to be a good global citizen, but also to contribute to that wider goal of Wales being a globally responsible nation. What I'm going to do now is stop sharing my screen, and then we're just going to give a little bit of an opportunity for audience members to ask questions or comments. So if I stop sharing now, Liz, and hand over to you, if you wanted to add any additional comments, but also take any questions, and I think our host will have to help us to get people onto stage who want to ask questions as well.
That's fantastic, and thank you so much, both of you, for that really great introduction and overview. I know you've worked very, very hard on this, along with all the other collaborators and some of the stakeholders who tested it as part of the pilots as well. So we've had one question. Are the modules open to university staff as well as NHS staff? Is it possible to allow guest access to this course to make it available to individuals not currently employed by the NHS? So yes, we're definitely looking to make it accessible more widely. Those who have access to the Learning at Wales platform can use that, and they can register and undertake these 6 modules. But in the longer term, we're looking to make it, we're going to test this, we're going to launch it, we're going to roll it out and continue promoting it. And then we aim as part of the next phase to allow it to become or make it accessible for more organisations if we can. Jill, Susie, do you have anything else to add?
I think to say that, I mean, I think where we've at the moment, even for myself with access, because I'm not an NHS staff member, I just requested my username and password from the team that run the platform. So I'm sure for those who want to access it and get involved, we'll be able to make sure that happens, because ultimately the more people who are taking the modules and learning from them, the better for us getting it out there and also getting feedback. So if you do want access and you're struggling to access this, I'll check my email in the chat, so please drop me a line and I'll help you out.
Yes, and you can also drop me a line. I'll put my email in the chat as well, and I can try and facilitate that for anybody, their organisations as well.
And I guess we really want to make sure that students can access it who may not be registered on employment systems. So, we really do want to look now to try and make it go wide, and eventually possibly have this to be something that can be adapted for other public sector employees as well. So
yeah, I mean, I would say as that's a real ambition of ours. This one has been, I think anyone who took the modules would have something to learn, but it has been very much tailored towards NHS staff in Wales. It would be a real delight and a sort of ambition to develop similar adapted modules for different parts of the public sector, but also beyond. Love to have modules adapted for private sector, because actually if we're going to become a globally responsible nation, everyone needs to get involved. And I think that's something that's an ambition for us, certainly, to make that global citizenship part of everyone's lifelong learning journey.
Yeah.
There's a question there from Dr. Kerry Jones. There we are, it's popped up on the screen. Thank you to whoever made that happen.
Amazing.
So is it accredited and is it available outside of Wales? So Liz or Jill, do you want to take that one on?
Well, it's currently not accredited, but it is something that we can think about. It definitely contributes to people's CPD, and they can utilise that and the learning that they've gained from that. In terms of being available outside Wales, currently it's not, but we can explore access to that. And certainly it's a question that hasn't actually really arisen to any great extent, because as Susie says, it's been primarily written for health professionals and organisations in Wales. So it doesn't mean to say that it can't be accessed. And also, we've kind of tailored it. So we've got not just included in it the Sustainable Development Goals, but actually the Wellbeing of the Future Generations Act. So it's kind of all its background is aimed, and the context is mainly at Wales, because these set of modules will help organisations demonstrate how they can try and maximise one of the 7 wellbeing goals for the Wellbeing of Future Generations Act, which is the globally responsible Wales, as well as a healthier Wales and a more equal Wales, which are, key drivers for health and well-being in Wales, really. So,
and I guess if I was to come in on that as well. So as WCIA, we do have some other online learning opportunities available, which we've got some around the economic models that underpin the Sustainable Development Goals and Wellbeing Goals. We've got some other modules around critical thinking. So there are, again, I've put my email in the chat, but there are other activities and modules available which are more tailored to both sort of a Wales audience, but we've also got modules that have been developed with partners around the world that are tailored to a kind of more global audience and have less of that Wales focus. So, be happy to share some links to those in materials that follow up with delegates to the conference.
Yeah. So just thank you. Scotland have got their own that they initially we looked actually at producing a suite of modules that would suit Scottish and Welsh staff, but we soon became aware that that wasn't going to be very easy, just because of the different infrastructure in each country and the different links that we had. But we have commented on each other's modules in the early stages, and they have their own core module, but they haven't done any deep dives so far. But I know that they will be very interested now that we've launched it in further sharing. And also Health Education England have done some work on global citizenship and are very interested to see. But we wanted to share it with you in Wales first before going wider.
Yeah, and Scotland launched their global resources last week, I think it was. So yeah, because I looked, I went, oh, they've picked us to the post.
Something that was, maybe I didn't mention in the presentation, but something that felt really important as we developed these, which I think was something that was a bit, because the Scottish modules are perhaps a kind of a higher level in terms of academically a higher level, because something that we talked about in the early stages of the modules was that these should really be very accessible, because global citizenship shouldn't be something. It's funny because we have the same conversations in school education, where there sometimes can be a tendency to start local when the children are young and then to move more global as they get older. And we're like, no, actually, right from the start, introducing children to global citizenship is really important. But I'd say the same here. It's not something that you do when you're at a senior level. Actually, global citizenship is something we can all be global citizens. There are actions we can all take. Mm-hmm. It is really important to have those skills in leadership, but it's also important to have those skills whatever role you're in. And so it felt really important and really influenced how we developed the modules, that they would be accessible, that they wouldn't use a lot of jargon, that they would be something that anyone really who works in the NHS hopefully could pick up and use and be able to kind of get some really good learning from those.
Mm-hmm. And I agree that it's got some really interesting learning that, we, even for those who may think that they're global citizens and they know quite a lot about this, the deep dives particularly are super interesting. The ones on globalisation, the importance of trade, free trade agreements, climate change, how it all resonates and it's all sort of interconnected. And it sort of makes you really think about those connections. And like Jill said, what might happen in one nation today will have ramifications for the longer term, potentially for others tomorrow across the world. So I think it may seem there's 6 modules and that's quite a lot and you do the core module, but I really recommend that actually you look at those deep dives as well. And even if you only do 1 or 2 of them that may sort of float your boat, as it were, then I think it'd be really, really worthwhile. We've had another, it's more of a comment really, from Mariana Diakova. Is it worth organising a webinar with our international networks to showcase it as a way of advancing the SDG agenda?
Mm-hmm.
Which is
definitely
a good idea, really.
Yeah, I think that would be really good.
I think so. And just it's an opportunity, I think, with, we've all got international partners around the world and this is just one way. And I think, there's some really easy technology there to create online modules. I mean, we're lucky in this case to have the Learning at Wales platform. But, as an organisation, there are also other platforms that we've used independently for different modules that have been very easy to use. And it's increasingly easy to create really good online interactive content that really gets people thinking. And even some of the platforms allow people to interact from around the world. And I think that can be quite powerful as well. So I think anything we can do to forward the global citizenship agenda and to get as many people, not just in Wales, but around the world as active global citizens, as I look at all of the negotiations on COP26, I'm sure there are numerous global citizens amongst those negotiating, but I certainly wish deeply that every single one of those negotiating had strong global citizenship skills through their lives and as they grew up, because it is that understanding of the complexity and the interrelatedness of the issues we face that enables people to come to agreements, to understand other perspectives, and to be able to work together towards things that will work, and to empathize with people who are facing different challenges or the same challenges in different ways. So yeah, vitally important. I think a question's come in there from Catherine. How can we raise awareness of this with NHS staff and encourage people to use it? So yeah, do you want, and also Liz, the question there, do you want the audience here to help in any way? Because I think we've got an audience of really good active global citizens here to help.
I was really pleased to see that, actually, because one of the things that we're going to do when we talk about the next steps is about how do we ongoingly raise the profile of this, how do we make so that it's not just today that it's launched and people are aware of it, but it is used, and that it continually is promoted and used, and how we engage with people to tell them about it, so that they can get the benefits of the great knowledge that Susie, Jill, Jen, and everybody else who's contributed to it, they can learn from that. So, but also that we get the feedback. It's a two-way thing about how we could improve it, update it, modify it, if there are anything else. So I'd be really interested to see if anybody's got any ideas around how we can do that. Roger, have you got any ideas? I see you've popped something in the chat quickly.
I think one of the things that people could do is link us to where you think it should be presented. Certainly the NHS Confederation, I think, is definitely one arena that we'd want to be linking with, and their conference as representative of the NHS in Wales. And there are probably very many other areas as well. So, but you will know them better than us. So please tell us.
Yeah. I suppose if I speak from, it's more of a WCIA perspective, but I mean, I think in general, we'd really like to see these kinds of modules, both these that have been developed. And I think it's a really pioneering effort by Public Health Wales to really take this on board and invest time and energy in creating these modules. So, I think we'd love to see part of a kind of standard training package for some levels in the organisation. That's something that I think would really drive it forward. But I think in general, really recognising these skills and global citizenship as part of leadership training, as well as entry-level training, I think would be really helpful. But I also think linking in with the different training networks and making sure that the message gets out there as strongly as possible. And I think also those of you who are in the sector, who are in the NHS, if you take the modules and you think they're worth recommending, to really be advocates for them and to share them with colleagues, because I think you can go down the route of mandating training, and that can be really helpful and certainly lead to more people taking it. But I think actually when people take something of their own accord, something they've chosen to take, because you need to engage with the themes for them to really mean something, that voluntarily entering into them and really seeing the value of them, I think means that the modules will have a greater impact than if someone feels like they're being made to take them as part of a mandatory program. So both have a value, but I do think sort of getting recommendations from NHS staff and the word of mouth would be incredibly helpful to spreading the message and getting people to take these and properly engage in them.
Yes, and definitely for managers within the NHS to enable their colleagues and their teams to take them, as well as advocating for them, because it's sometimes people have greater commitments than outside of work than they can within work, and so therefore as a CPD opportunity and a learning development opportunity, I think there's something there for us to try and make sure that there are advocates across all the levels of the NHS and health boards and organisations. We've had quite a lot of activity in the chat. So is there Roger's suggested there's another benchmarking tool. Then is there a possibility for a different sector to create its own module? That's from Paul Lindowood, Disability in Wales and Africa. Yes, absolutely.
If I might just answer that
Yes.
one, I think in a little more detail. So I think, yes, definitely. Something that was really valuable here was that Public Health Wales obviously had a bit of a budget to invest in this and some staff time as well, because the budget was fantastic and enabled lots of third sector organisations to get involved in the development of the modules. But it was also the steering group, because the third sector experts who had the global citizenship expertise required the NHS expertise from the steering group. So I think if modules are going to be developed for a different sector, that time input is important. So I think absolutely there are opportunities to do that. But I think it needs that sector to have a bit of time and energy to put into it to make sure that the modules genuinely are useful to the sector. If just the third sector participants had sat and written the modules, it would have been really difficult to make sure that they had that NHS relevance. And it's that partnership that I think has created something really, really strong here.
I think, I would agree it's the co-production element that is really important. But I know that Paul, has colleagues and certainly, looking at issues of disability is really important as well. So globally, we probably don't know enough in the NHS about the backgrounds where perhaps we'll be treating patients, that have come from other countries. So there probably is a real need for quite a few module additions, and in a way that was how it was always designed, so that it could be added to. It's an iterative product, and probably we'll need to update, modules in time as well. But it was a relatively small budget, but we had probably much more of Jen Jones than we paid for, I would say, from Oxfam Cymru, and certainly lots more of Susie and others. So I think everybody gave. Actually, this became a passion that people wanted to see this product. So a lot can be done on goodwill, but it would be great if this could be used as a sort of basis of applications for grants to add to it and to improve the product.
Yeah, thank you. And we've had quite a lot of really interesting suggestions about how it could be used as part of training and undergraduate and postgraduate training. So links to MScs in global health, additions to undergraduate health professional education in universities. So yeah, this is fantastic. This is great. So there's been quite a few suggestions, but no more questions. If anybody else got any questions.
And I was just going to say, actually, those suggestions, really welcome follow-up conversations with people making those suggestions. I think we would absolutely love to get more of this in higher education. Again, global citizenship, especially with the new curriculum, now has a fantastic schools focus, but getting that into the next levels of learning is really important.
So I think that's about it. I think I
have my one more slide, because I like to finish with a bit of interaction too, Liz.
Yeah, I was going to say I'm not missing out on the extra Mentimeter exercise.
I can't resist, folks. I'm afraid we create interactive modules. We have to have a bit of interaction in the session. Someone just asked, just a quick answer. Someone just asked if it could go on ESR, which is the electronic staff record, and it is or will be on there. So that was the message I got from Julie, who's also been working in the background, making sure the modules get online.
Julie Rogers has been fantastic.
Julie Rogers said it will be on the electronic staff record and the Learning at Wales platform, so accessible via both.
That's it. And then, so for us, for the next steps, really, it's about the evolution, launching it, promoting it, and then trying to see whether or not we can utilize it for other platforms, for other sectors, and then just maybe updating it and monitoring its use. I don't know if you've got anything else to add to that, Jill or Susie?
I think it's a really groundbreaking format that has just huge potential, and I really would love to see it for much wider sectors than health. And I think really good points about how it could be used with higher education, further education, and also perhaps thinking of the Welsh back and just some of the inputs that might be useful for that as well. So I really think that this could go very far if it has just a tiny bit of investment. Yeah.
Great, thank you.
So much.
I know you have to leave now, Jill. You've got a super important meeting with the Minister, so thank you very much.
Bye-bye. Thanks very much.
Thank you, Jill. Bye.
Yeah, it's very hard not to forgive someone who's heading up the vaccine programme to go and meet with the health minister. It feels,
I know, what would we do without her? Yes.
So I just, I mean, feel free to keep posting comments or questions in the chat, but I did just want to finish with a bit of a sense of the room in terms of what extent you feel you're global citizens. And I've just popped up 3 questions, same Mentimeter slide. So again, it was really nice to see the word cloud earlier. And I just wanted to finish up by asking these 3 questions, which I hope will kind of work for you. So give it a go, answer the questions. And let's see if we can get a sense of the room and how people feel. Just got the results coming in now. It's always really nice to see. I feel like we've probably got a room of some fairly empowered, active global citizens, but we shall see. I'll give it a few more moments. And thank you to those who've shared contact details. I'll try and make sure I get those. But also happy for anyone to drop me an email. I'll put my email in there again, just so you've got it ready. To follow up on any of those discussions after the session today.
I've posted the link to the core module, so those who hopefully can access it could see it in actual real life, or maybe try and register for it. So I've just put that in the chat box, and if anybody has any difficulties, they can contact me or Susie. So
fantastic. Oh, Liz, I'm just going to correct the link, because that one is it's the review rather than the
that's the one I had.
So yeah, no, let me send you to let me just put that
the correct one.
Yeah, it's fabulous. Actually for those who can, I mean, and as I say, if you can't get a Learning Wales password directly,
which is available for most public organisations in Wales.
Yeah, and it's also for third sector organisations, although as a third sector organisation, you may have to request a password because some of the email addresses it doesn't like. So if you go to the Learning Wales platform, I've put the link in the chat, log in, you can find the global citizenship modules. You can just search global or global citizen and they pop up. If you do have any trouble accessing, obviously you can give us a shout, but you can also directly contact the platform providers and they should be able to get you a login and get you access to the modules. They have just gone live in the last couple of days after some last minute COVID updates to them. So, you know, do give them a shout if you have trouble accessing.
Fabulous. Thank you, Susie.
And just lovely on the slides. I mean, it seems like those who have responded, we've got, you know, people feeling like they can make a difference through their job in their community, and even a really good number feeling like they can make a difference on global issues around the world. And I have to say, it's really encouraging to see people feeling, you know, relatively empowered, even in these quite challenging and complex times. So, yeah, just a huge thank you from me. I think we're wrapping up a little bit early, but by 10 minutes, but I know no one ever minds an extra time for a cuppa. Cass, did you want to come back in, I think, to say about the polls at the end and things like that?
Yes. Yes, please. That would be great. I'm just going to publish some polls now, if that's okay, Susie.
Absolutely. And just a huge thank you to everyone for attending and listening, and really excited to get these out there after a long journey.
Yes, and I hope that you all find them useful and help us to spread the word. So thank you very much.
I always feel that both the beginning and the end of conference type sessions that I should have a good repertoire of appropriate stand-up comedy, but I've yet to develop it.
Well, we could always turn into a dream team, Susie.
There is that.
We could take this on virtual tour.
Okay, it looks like people are slowly filling up the poll. If anybody else has got a chance to, if you're having difficulty seeing it, it's on the right-hand side and next to the chat. Is that how it pops up for you, Susie?
Yeah.
Okay, great.
Yeah, I'm not going to fill it in for our own session. That would feel...
No. I was just checking how you see it. This is how I see it.
Definitely.
Okay, great. Thank you very much, everybody, for doing the poll. Thank you for taking part. And thank you, Susie and Liz. That was really interesting. I want to have a go myself, even though I'm not an NHS staff. That'll be all right, won't it?
I'm sure we can facilitate it for you, Kath.
Appreciate it. Thank you.
Thank you.
Okay, lovely. I think we can finish. I think we can bring Catherine on stage. Catherine, are you coming?
Am I back on stage? Can you see me?
We can hear you. You might need to turn your camera on.
I've turned my camera on. Oh, yeah. There we are. I'm through. Thank you. That was so grateful for all the work that's gone into this, and it's certainly been a co-productive effort, hasn't it, across organisations. So, but Susie in particular and Liz for driving it and getting it to this point. So you put your contact details in the chat. So for all those people who want to know more, they can get in touch with you directly. And of course, anything that we can do through Wales and Africa Health Links to support it, we'd be more than willing to do. So thank you for your time. Just to let people know that our next session starts at 11:30, so you've got time to have a quick walk round and do your Tai Chi and have a cup of tea or catch up on emails if you have to. So that's about promoting nurse leadership, and it's a report from the Nursing Now Cymru Wales steering group, which is a fascinating global programme because nurses are the backbone of the healthcare system, and the Nursing Now campaign is all about empowering women as nurses and midwives. And many countries have signed up to it, but Wales in particular has had an active group, and that's also engaged in international activity. And here's some examples of that. And I can see Diane is here now, and I'm really looking forward to hearing from you, Diane. And then we've got another short break, and then a session at 1 o'clock on maternal health in Zambia with Dr. Chua Jacobs, who did a really good session last year, and it's looking at how the last 12 months have had an impact on essential services for women and children in Zambia, because things have been so difficult because of the impact of COVID and its indirect effects. Then at 2:30, we've got a really interesting session where the head of the Swansea Medical School is going to talk about their experience of the challenges of dealing with racism that was brought up by the students and how she responded to that. And we'll combine that with an introduction to the new Hub Cymru Africa Anti-Racist Charter, which is a work in progress. So it'd be really interesting to get some feedback from people on what they think about that and where it's going. And then last but not least is our final session at 4 o'clock, which is going to be a highlight where we have presentations from 4 of our active links, particularly focused on how they've responded to the challenges of COVID on their partnerships, the new things they've done, how they've adapted, how they've changed things in response to what's happened in the last 18 months. So that's at 4 o'clock, and please do come to that, because we want to support the people who've done their best to carry on doing what they've been doing in these circumstances. So that's our real activists on the ground, and they really, really want to share what they've done. So I would appreciate people coming along to that and learning, because we are full of optimists in this community, in this sector, and that's what we need at the moment. Everybody needs an injection of optimism. So hopefully we'll be able to provide that through the rest of the day, and pace yourselves as we go through it. The last thing I just wanted to highlight is we have our annual lecture on the 2nd of December. We have invited Dr. Tony Jewell, a previous chair, to arrange a speaker on an annual basis. And this year's speaker is Professor Anthony Costello, who some people may know has had quite a profile in the media. He is a paediatrician by background, is very involved with the World Health Organization. He's on the Independent Stage Advisory Committee, and he's going to talk about a future for our children. and he will be joined by Sophie Howe, the Future Generations Commissioner, to respond to the issues that he raises. So that should be a really interesting lecture and response from Sophie, and then a debate. So that's Thursday, the 2nd of December. Registration will open shortly, so we'll send all this information and as much as we can from the sessions in the conference to everybody who's registered. So you will get communication from us about that. So please hold that date in your diary, the Thursday, the 2nd of December. So thank you very much, and thank you to our speakers again, and hopefully see everybody in half an hour at 11:30, and hopefully we'll have our Chief Nursing Officer back then as well. Thank you very much, everybody.
Thank you. Bye.
Bye.